Alrighty, so I've already introduced myself, verified orders, provided privacy, completed vitals, and confirmed who the patient was. Alrighty, so for your head, have you experienced any facial drooping?
No.
Okay, the head appears to be just normal size and symmetrical. Ears, are you having any ringing in the ears?
No, I'm not.
Okay, perfect. Ears appear to be normal and symmetrical, and we would test for hearing standing about arm's length away, saying a combination of 3 letters and or numbers. They would repeat it back to me. It's called the whisper test. Alrighty, and your eyes. Are you having any difficulty seeing or having any blurred vision?
No.
Okay, perfect. Your pupils seem to be round and equal, about 4 millimeters. And you look straight ahead and check your pupils. They are reactive to light. We're going to have you look at the pen and follow it. And they are accommodating. Perfect. And then we're going to your nose. Shape seems normal. And then we'll have you place one finger over one nostril, breathe in, and do the other nostril. Nasal patency appears to be normal. And then we're going to check your mouth and throat. So we're going to open and say, ah. Perfect. Oral mucosa appears to be shiny and pink. Teeth do not have any visible decay. And then we're going to check your throat. Perfect. Trachea appears to be midline. And then for your neuro assessment, we've already confirmed his name. Do you know today's date?
February 9th, 2024.
Perfect. And do you know where you are?
In my kitchen.
Perfect. Alrighty, and so that appears to be normal. Are you experiencing any headaches?
Nope.
Perfect. Did want to discuss the Glasgow Coma score. That is just the baseline for your level of consciousness. It's rated on a 3 to 15 scale. There are 3 different categories where it breaks up to your eyes, verbal, and motor skills. Alrighty, and now we're going to move on to your respiratory assessment. Are you having any difficulty breathing?
No.
Okay, perfect. I'm going to go ahead and listen to your breath sounds. And as you feel the stethoscope move, you'll just take deep breaths. So we are on your right upper lobe. Perfect. Left upper lobe. Left lower lobe. Right middle lobe. Perfect. We'll listen to your back. We have your left upper lobe. Right upper. Right middle. And left lower. Listen to the side. We're going to do your right side first. So this will be your right lower. Perfect. And your left lower. Everything sounds good. It is equal and unlabored. And then we have a couple techniques to help to keep things moving and a mucus buildup. It's to turn, cough, and deep breathe. So what you do is you inhale real deep, turn your head to the side and cough. And then we have the incentive spirometer. X is the same way, but you'll just breathe in as deep as you can and hold it. I'd like you to do that 10 times within an hour. Alrighty, and then we're going to move on to the cardiac assessment. Are you having any chest pain?
No.
Perfect. Alright, we're going to check for JVD, so you'll turn your head to the side, and everything looks good there. And then we will listen to your heart sounds, and you can just breathe normally for this one. And we got your aortic, and your pulmonic, herbs, thoracic, and mitral. Perfect. And then we are going to check your pulses on each side. So we'll check your radial pulse. There's regular +2. Regular +2. We'll check your posterior tibial. That is regular +1. Regular +1. And then your dorsalis pedis on top of the foot. That is going to be regular +1. Well, since I'm down here, we'll go ahead and start and check for edema on the legs. With negative there, we'll check on your arms. That's negative. And then we'll check for capillary refill. Everything looks good, less than 3 seconds. Perfect. And then we will move on to the musculoskeletal. So, are you having any elbow pain?
Yeah.
Okay. Alrighty, and what we're going to do is we're going to check the range of motion on your elbow. So you'll hold your arm out, palm up, and then you'll bring it to your shoulder. That is flexion. Bring it back. That is extension. And I would hold on the joint while he is moving that with my non-dominant hand to feel for crepitus. Okay, perfect. And we're going to leave your arm up. We're going to check your forearm. So you're going to rotate your palm down. That is pronation. Palm up. That is supination. And you can put your arm down. And then we're going to have you stand up. We're going to check on the knee. So if you need to brace yourself, you can. All you're going to do is bend your knee backwards and back down. So backwards would be flexion, and then back down is extension. And then we're going to check the ankle. So you lift your foot up, toes to the sky. That is going to be plantar flexion. Toes down is going to be dorsiflexion. And then I would ask the patient to do the toe-to-toe sobriety walk, or also tiptoe. And then to check for gait, and then we're going to check for balance. You're going to stand still, arms to your side, and close your eyes. And there's little to no swing, so he is good, and that is it.